Good. Let's look at chapter 24 now. Chapter 24 is on vital signs and a couple of key points. First, vital signs are measured for a reason to detect changes in body functions. Body temperature normally changes slightly throughout the day. Temperatures above or below your client's normal reading should be reported. A variety of thermometers are available. You'll be trained how to use them. Pulse rate is the heartbeats that are heard in 1 minute. PSWs may use a pulse oximeter to measure both a client's pulse rate and oxygen level. Respirations are normally quiet, effortless, and regular. Blood pressure is the amount of force exerted by the blood against the walls of the artery. And the period of heart contraction is called systolic, and the period of relaxation is called diastolic. Ensure that you know your scope of practice and your employer policies before you start doing your client's vital signs. Good, and now let's look at chapter 24 in your workbook. There are 88 questions plus a crossword puzzle. And the first 21 questions are true or false. Question number 1, a handheld electric thermometer is stored in a storage box. False, usually in a utility room. Number 1 is false. Number 2, systole is a period of time when the heart muscle is relaxed. False. Diastolic is relaxation. Number 2 is false. Number 3, bradycardia is a rapid heartbeat. False. Slow heart rate. Question number 3 is false. Number 4, blood pressure is normally measured in the brachial artery. True. Number 4 is true. Number 5, if you're unsure how to take a blood pressure reading, take the cuff off and try again in 30 to 60 seconds. True. Number 5 is true. Number 6, systolic pressure is lower pressure. False. Higher. Question number 6 is false. Number 7, respiratory rate vary with age. True. Number 7 is true. Number 8, tympanic thermometer is inserted in ear. True. Number 8 is true. Number 9, auxiliary temperature can take up to 2 minutes. False. Usually 30 to 60 seconds. Number 9 is false. Number 10, the earpiece and diaphragm on a stethoscope should never be cleaned. False. Always be cleaned. Number 10 is false. Number 11, rhythm and force are characteristics of a pulse. True. Number 11 is true. Number 12, you should avoid using your thumb because your thumb has a pulse. True. Number 12 is true. Number 13, blood pressure increases with age. True. Number 13 is true. Number 14, women usually have higher blood pressure than men. False. Other way around. Number 14 is false. Number 15, the lower the blood volume, the lower the blood pressure. True. Number 15 is true. Number 16, stress decreases blood pressure. False. Increases. 16 is false. Number 17, blood pressure is higher in overweight people. True. Number 17 is true. Flip over the page. Number 18, blood pressure is lower among South Asian, Indigenous, and African descent. False. Higher. Number 18 is false. 19, smoking increases blood pressure. True. 19 is true. 20, normal newborn respirations are 30 to 60 a minute. True. Number 20 is true. Number 21, 25 to 32 respirations is normal for adult. False. Number 21 is false. Good. Questions 22 to 25 now. Multiple answers for these. Question 22. When would you expect vital signs to be measured? A as in apple, B as in boy, D as in dinosaur, F as in food, G as in good, H as in house. Question 22. Answers are A, B, D, F, G, H. Good. Question 23. Temperature should not be taken orally if the client, B as in boy, C as in cat, D as in dinosaur, E as in elephant, F as in food, G as in good, H as in house. Question 23. Answers are B, C, D, E, F, G, H. Good. Question 24. Which of the following factors can affect the pulse rate? A as in apple, B as in boy, C as in cat, D as in dinosaur, E as in elephant, F as in food. Question 24 answers are A, B, C, D, E, F. Good. Question 25. When you are taking a client's blood pressure, which of the following guidelines should you follow? B as in boy, D as in dinosaur, F as in food, G as in good, H as in house. Question 25 answers are B, D, F, G, H. Good. Let's look at questions 26 to 33 now. Just one answer for these. Question 26. Why is it important to keep a record of previous vital signs? B as in boy. Doctor can compare each measurement. Question 26. The answer is B. Next page. Question 27. When you take vital signs and they've changed, what should you do? C as in cat. Report to the nurse. Number 27. The answer is C. Number 28. Which of these statements is true about electronic thermometers? Is not true. B as in boy, if the probe is broken, the client will swallow mercury. They don't have mercury in them. So question number 28, the answer is B. Question number 29, if the client is smoking, you need to do an oral temperature. What should you do? B as in boy, wait 15 minutes. Question 29, the answer is B. Number 30, for how long should you take an irregular pulse? D as in dinosaur, 1 minute. Question 30, the answer is D. 31, when assessing a client's pulse, which of the following rates should be reported to the nurse? B as in boy, 50. Question 31, the answer is B. Question 32, you're assigned to take blood pressure of several clients. Which of these measures should you report? C as in cat, 150 over 110. Question 32, the answer is C. Question 33, what best describes a pulse oximeter? B as in boy, measures the oxygen level in the blood and pulse. Question 33, the answer is B. Good. Flip over the page. Let's look at questions 34 to 39 based on the picture. Question 34, which letter is showing you the diaphragm piece of the stethoscope? F as in food. Question 34, the answer is F. Question 35, which letter is the bell? D as in dinosaur. Question 35, the answer is D. Question 36, which letter is the earpiece? A as in apple. Question 36, the answer is A. Question 37, binaurals, that is the letter B as in boy. Question 37, the answer is B. Question 38, which letter is the plastic tubing? C as in cat. Question 38, the answer is C. Question 39, which letter is the chest piece? E as in elephant. Question 39, the answer is E. Good, let's look at the next page, questions 40 to 54. Match the words in the right column with descriptions in the left column. Question 40, oral is A as in apple, 35 to 37 degrees. Question 40, the answer is A. 41, auxiliary, B as in boy, 34 to 37 degrees. Question 41, the answer is B. Question 42, tympanic membrane, C as in cat, 35 to 38 degrees. Question 42, the answer is C. Question 43, temporal, that's G as in good, side of head. Question 43, the answer is G. Question 44, carotid, E as in elephant, side of neck. Question 44, the answer is E. Question 45, brachial, A as in apple, inside the elbow. Question 45, the answer is A. Question 46, radial, H as in house, wrist. Question 46, the answer is H. Question 47, femoral, C as in cat, top of inner thighs. Question 47, answer C. Question 48, popliteal, F as in food, knees. Question 48, the answer is F. Question 49, dorsal pedis, B as in boy, ankles. Question 49, the answer is B. Question 50, apical, D as in dinosaur, chest. Question 50, answer is D. Question 51, 120 to 160, C as in cat, birth to 1 year. Question 51, the answer is C. Question 52, 75 to 100, A as in apple, school-age children. Question 52, the answer is A. Question 53, 90 to 140, B as in boy, toddler. Question 53, the answer is B. Question 54, 60 to 100, D as in dinosaur, adolescent. Question 54, the answer is D. Good. Flip over the page. Let's look at questions 55 to 67. Match the words in the right column with description in the left column. Question 55, taking the apical and radial pulse at the same time. C as in cat, apical radial pulse. Question 55, the answer is C. Question 56, amount of force exerted against the walls of an artery. F as in food, blood pressure. Number 56, the answer is F. Question 57, disorder in which systolic blood pressure is 90, diastolic is 60. I as in I am. Hypotension. Question 57, the answer is I. Question 58, instrument used to listen to the sounds produced by the heart and lungs. L as in lady. Stethoscope. Question 58, the answer is L. Question 59, slow heart rate, less than 60 beats a minute. G as in good, bradycardia. Question 59, the answer is G. Question 60, active breathing air into and out of the lungs. A as in apple, respiration. Question 60, answer is A. Question 61, persistent blood pressure measurements above the normal systolic. E as in elephant, hypertension. Question 61, the answer is E. Question 62, rapid heart rate over 100 beats per minute. B as in boy, tachycardia. Question 62, the answer is B. Question 63, period of heart muscle relaxation. D as in dinosaur, diastolic. Question 63, the answer is D. Question 64, beat of heart fills artery as a wave of blood passes through the artery. J as in jumping. Pulse. Question 64, the answer is J. Question 65, instrument used to measure blood pressure. M as in mother, sphygmomanometer. Question 65, the answer is M. Question 66, temperature, pulse, respiration, blood pressure. K as in kettle, vital signs. Question 66, the answer is K. And question 67, period of heart muscle contraction. H as in house, systolic. Question 67, the answer is H. Good. Next page, questions 68 to 75. Identify whether the words are talking about pulse or blood pressure. Question 68, radial. A is an apple pulse. Question 68, the answer is A. Question 69, bradycardia. A is an apple pulse. Question 69, the answer is A. Question 70, hypertension. B as in boy, blood pressure. Question 70, the answer is B. Question 71, systolic. B as in boy, blood pressure. Question 71, the answer is B. Question 72, hypotension. B as in boy, blood pressure. Question 72, the answer is B. Question 73, diastolic. B as in boy, blood pressure. Question 73, the answer is B. Question 74, apical. A as an apple pulse. Question 74, the answer is A. And question 75, tachycardia. A is an apple pulse. Question 75, the answer is A. Good. Fill in the blank questions now for question 76. For how long is an auxiliary temperature taken with a thermometer? The answer is 30 to 60 seconds. 30 to 60 seconds is the answer for question 76. Good. Question 77. Why are the earpieces and diaphragm on a stethoscope cleaned with alcohol wipes before and after use? The answer is to prevent the spread of microbes. To prevent the spread of microbes is the answer for question 77. Question 78, how can you prevent noise when you are using a stethoscope? The answer is do not let anything touch the tubing and ask the client to be silent. Do not let anything touch the tubing and ask the client to be silent is the answer for question 78. Good. Question 79, when you're measuring the pulse, what two characteristics of the pulse should be noted? The answer is rhythm and force. Rhythm and force is the answer for question 79. Question 80, why do you keep your fingers or stethoscope in place after you count the pulse and while you're counting the respirations? The answer is so that the client does not know you are counting respirations, and therefore the client will not change breathing pattern. So that the client does not know that you are counting respirations, and therefore the client will not change breathing pattern is the answer for question 80. Good. Flip over the page. Question 81. How do these factors affect blood pressure? So the answer for A is increases. Increases is the answer for A. The answer for B is women have lower blood pressure. Women have lower blood pressure is the answer for B. The answer for C is the lower the blood volume, the lower the blood pressure. The lower the blood volume, the lower the blood pressure is the answer for C. The answer for D is increases blood pressure. Increases blood pressure is the answer for D. The answer for E is usually increases blood pressure. Usually increases blood pressure is the answer for E. The answer for F is increases blood pressure. Increases blood pressure is the answer for F. The answer for G is blood pressure higher in overweight clients. Blood pressure higher in overweight clients is the answer for G. The answer for H is higher in South Asian, Aboriginal, and African descent. Higher in South Asian, African, and Aboriginal descent is the answer for H. The answer for I is sodium increases blood pressure. Sodium increases blood pressure is the answer for I. The answer for J is can raise or lower blood pressure. Can raise or lower blood pressure is the answer for J. The answer for K is lower when lying down. Lower when lying down is the answer for K. The answer for I is increases blood pressure. Increases blood pressure is the answer for L. And the answer for M is increases blood pressure. Increases blood pressure is the answer for M. Good. Question 82. If a client cannot stand up or have his height measured, what procedure will help gather this information? Measure client's height in bed. Measure client's height in bed is the answer for question 82. Good. Question 83. Why do you ensure your client has voided before you weigh them? Answer is a full bladder affects weight. A full bladder affects weight is the answer for question 83. Good. Question 84. The height and length of a young child is taken from the top of the head to the heels. Top of the head to the heels is the answer for question 84. Good. Question 85. What is the normal respiratory rate for the following ages? So the answer for A is 30 to 60. 30 to 60 is the answer for A. The answer for B is 20 to 30. 20 to 30 is the answer for B. The answer for C is 25 to 32. 25 to 32 is the answer for C. And the answer for D is 12 to 20. 12 to 20 is the answer for D. Good. Question 86. What are some guidelines to follow when measuring a client's blood pressure? So the answer for A is don't take on arm getting an IV. Don't take on arm getting an IV is the answer for A. The answer for B is rest for 10 to 20 minutes first. Rest for 10 to 20 minutes first is the answer for B. The answer for C is take while client is sitting or lying down and document. Take while client is sitting or lying down and document is the answer for C. The answer for D is use correct size cuff. Use correct size cuff is the answer for D. And the answer for E is apply cuff to bare arm. Apply cuff to bare arm is the answer for E. Good. Next page, question 87. Fill in the following drawings so that the dials show the correct blood pressure. So they just want you to put a little dash for 87A. You put a dash at the number 168. So each little black dot represents 2. So it would be 4 dashes above the number 160. And then the next number is 102 for question A. So 2 dashes above the number 100 for that one. And then question B, they're asking you to document 104 over 68. So the first picture in question B, you would go 2 dashes above the number 100 and put your line there. And the second picture for picture B, you would go 4 dashes above the number 60 and put your line there for number 68. Good. And then question 88, fill in the following drawings so the mercury columns show the correct blood pressure. So they want you to draw all the way up to the correct number. So picture A, the first picture of the thermometer is number 152. So 2 dashes above the number 150. And the second picture in picture A, they want you to document 86. So 3 dashes above the number 80 for that one. And 88B, 198 over 110. So 198 would be 4 dashes above the number 190. Fill all that in below. and the second number is 110. So the second picture would be exactly where it says the number 110. Color everything below that number. Good, and then flip over the page and let's do the crossword puzzle. Starting with the words that go across, two across, taking the apical and radial pulses at the same time, 3 words. That's called apical radial pulse. Apical radial pulse is the answer for 2 across. Now let's look at 5 across. Amount of force exerted against the walls of an artery by the blood, 2 words. Answer is blood pressure. Blood pressure is the answer for 5 across. Now let's look at 6 across. Disorder in which systolic blood pressure is below 90 and diastolic is below 60. Answer is hypotension. Hypotension is the answer for 6 across. Now let's look at 8 across. Instrument used to listen to the sounds produced by the heart, lungs, and other body organs. Answer is stethoscope. Stethoscope is the answer for 8 across. Now let's look at 9 across. A slow heart rate less than 60 beats per minute. Answer is bradycardia. Bradycardia is the answer for 9 across. Now let's look at 10 across. Active breathing air into and out of the lungs. Answer is respiration. Respiration is the answer for 10 across. Now let's look at 12 across. Persistent blood pressure measurements above 140 or diastolic 90. That's called hypertension. Hypertension is the answer for 12 across. Now let's look at 13 across. Rapid heart rate. Heart rate is over 100 beats per minute. Answer is tachycardia. Tachycardia is the answer for 13 across. Now let's look at the words going down, starting with 1 down, period of heart muscle relaxation. That's called diastole. Diastole is the answer for 1 down. Now let's look at 3 down, beat of the heart felt as an artery as wave of blood passes through the artery. Answer is pulse. Pulse is the answer for 3 down. Now let's look at 4 down, instrument used to measure blood pressure. Answer is sphygmomanometer. Sphygmomanometer is the answer for 4 down. Now let's look at 7 down, temperature, pulse, respiration, blood pressure, 2 words. Answer is vital signs. Vital signs is the answer for 7 down. Now let's look at 11 down, period of heart muscle contraction. Systole. Systole is the answer for 11 down. And that's it for chapter 24.